Hangnails are those pesky extra bits of skin that can pop up near your fingernails and cause a lot of discomfort. They can be caused by a few different things, like using nail polish remover a lot, exposing your hands to extreme temperatures, or even soaking your hands in water for too long. Even having brittle nails or dry hands can make you more prone to getting hangnails. And while they might seem small, they can actually be pretty painful and make it tough to do everyday things. When you have a hangnail, it might be tempting to rip it or bite it off. But that's not a good idea for a couple of reasons. Biting your hangnails can introduce bacteria from your mouth, which can lead to an infection. It can also transfer bacteria from your hands to your mouth, which could make you sick. Ripping at your hangnail can be just as harmful. If you trim it the wrong way, you could pull off live tissue and make the pain last longer. So what should you do when you have a hangnail? When you have a hangnail, it's important to resist the urge to bite or rip it off, as this can cause more harm. Instead, you can carefully trim the extra skin around the hangnail to reduce the risk of catching it on something and to help it heal faster. To safely cut a hangnail, make sure to use clean fingernail clippers and trim it as close to the nail bed as possible. Once you've trimmed the hangnail, you can consider soaking your finger in warm water or applying antibiotic cream to help with the healing process. To treat a painful or infected hangnail, you can start by soaking the affected nail in warm water. Fill a bowl with warm water and soak your nail 2 to 4 times a day for 15 minutes each time. It's important to use clean water for the soak, so if you don't have bottled water, you can boil your tap water and let it cool to a safe temperature. Boiling water helps to kill any harmful organisms that could be in the water, which is especially important if your nail bed is injured. You can treat a hangnail by using an over-the-counter antibiotic cream on the area once daily. After covering the hangnail with antibiotic cream, wrap your finger in a bandage to help the cream stay in place and prevent bacteria from getting into your hangnail while it heals. It's also important to wash your hands and clean underneath your fingernails. This can help prevent the area from becoming reinfected and worsening as a result. When a hangnail gets infected, it can become painful and swollen. In some cases, pus may form around the injury site, and this may need to be drained by a doctor. You can also try treating the infection with warm water soaks and antibiotic cream, similar to how you would treat a regular hangnail. However, if you notice any swelling, blisters or pus, discoloration of your nail or finger, or weakness in your fingernails, it's time to see your doctor for proper treatment. Ideally, we would never have to deal with hangnails. But in reality, there are some steps you can take to prevent them and minimize how often they occur. Practicing good nail hygiene, such as regularly washing and moisturizing your nails, especially during the winter, can help keep your nail beds healthy.